but it doesn't mean that you are not going to join. Please join and have this live conversation. So let's start it formally. Bismillah ar-Rahman Rahim. Assalamu alaikum. Good morning, good afternoon, good evening for everyone who have joined to spend your Saturday to learn about effective governance and leadership of health profession education institutions. Some housekeeping, please keep yourself mute. If you want to ask a question, please hands up or use the icon of the hand up. Put it in the chat and I will relate it in the end of the presentation. The presentation will be for 40 to 45 minutes, followed by 10 to 15 minutes of Q&A. So please put your question and answer in the chat, and later in the Q&A session, raise your hand. And please be engaged. It is for your learning. We all are spending our time in different time zones, and the intent is for you all to learn. So please participate actively in the discussion. With this small preamble, let me start and introduce. I don't think so I can ever do a justice in introducing Sir Gowhar Wajid, who is a mentor, a teacher, and also a distinguished expert and leader in health profession education, currently serving with the World Health Organization in the Eastern Mediterranean region. His work focuses on advancing the education and training of health professionals, I would say globally. I have seen so many amazing work that Dr. Gowhar Wajid has done, and how much he has guided me in my work as well. His work focuses on advancing the education and training of health professionals with a particular emphasis on policy development, governance, and workforce planning. Dr. Wajid provides strategic guidance to countries on strengthening health professions education systems to better align with population health needs, ensuring that the healthcare delivery is both responsive and sustainable. With this, I will hand over to Dr. Gowhar Wajid, and a huge thanks to Dr. Sabi, who has created this platform for us to sit together and have this conversation. Over to you, Sir Gowhar.
Bismillah ar-Rahman rahim. Thank you so much, Dr. Jabeen, for a generous introduction. Uh, this is the topic that we have today. I think this is the first presentation of the season for SIBU. So this is kind of opening presentation. The topic that we have today is quite close to my heart, as I have been working on this topic for almost now for over 2 years. So this is a kind of update that I'll be sharing with you related to the need for effective governance and leadership of health professions education institutions, because we find a big gap in the governance and leadership of the institutions. Yeah, kindly mute yourself, please. Thank you. Let me, when I was thinking of developing the storyboard for this presentation and making it relevant to the audience, and this is going to be especially relevant to our senior faculty,
40.
providing them some
We
guidance
changed
on the subject. Now, when I was thinking of developing the storyboard, I thought it better to relate it to our aspirational needs or aspirations, starting from a junior medical officer and all the way the typical career pathway that we follow after becoming a medical doctor, then our aspirations about having a specialty, developing our professional identity as a specialist, and then getting some kind of academic position or a consultant level position, and then uh, rising in that position to the senior levels, eventually becoming a head of the department in a tertiary level hospital or a medical school. That's what the dilemma of disease-based hospital-specific medicine is, that all of us, we aspire to become a kind of a specialized person, and aspiring to become a professor in academia or a senior consultant or head of the department in our respective specialty. But naturally, our aspirations don't end there. Then we are looking for positions in the institutions, like the dean of the faculty or our specialty, and then becoming the principal of the medical college, or in different names given to the principals, or we want to be on some kind of national committees related to our expertise, and we want to be known in our professional associations. If there is some pediatrician or a surgeon, he wants to be known in his country for the excellent work that the person is doing, and we want to be accepted and recognized in the country, and then regionally, and then naturally globally as well, sharing our expertise with others, and rising to the level in not only in academia. We want to be the kind of all-rounded person, contributing to the scholarship and to the academia and to research and to the clinical components of whatever the specialties I want. This is the typical aspirational journey of any medical doctor that I have experienced over the years. Now, the theoretical underpinning for this aspirational journey is there. There is a lot of evidence. The literature is full of this aspirational journey, and I draw this theoretical underpinning from our old Maslow's hierarchy of needs, introduced by Maslow somewhere in the 40s, where he mentioned that the levels of hierarchy of needs, starting from physiological needs up to then going to safety needs and love and belonging, developing friendship, intimacy, family, etc. And then up to the level when become further senior, we look for some kind of esteem, whether it be in the form of to be respected by our community and by our society, or self-esteem. You hear these words, oh, I have this status, oh, I was not given the due protocol that I deserved, my services are not being recognized by my people or my government for that matter. Oh, I deserve to have a medal, XYZ medal, Tamga Imtiaz or Sitara Imtiaz or whatever the medal is called in your country. That is the level of esteem that according to Maslow, that is level 4, if you may call it, of esteem, levels of esteem. But there is one more level above that esteem, that is what he calls self-actualization. That is what he calls the desire to become the most that one can be. A real, authentic person, a real value-based person, where you don't want to be known even for being rewarded for what you have said or what you have done. Rather, there is, that's a level of intrinsic motivation. This is one of the very basic theories of motivation introduced in 1940s, where respect, belongings, love, they are even of lesser value for you than the intrinsic values that you are carrying. So that where you can say that reward based system, you are beyond the reward, the expectations from the people, and you want to be known for the values that you are carrying. This is not the topic for today. I just wanted to mention it, that there is a very solid theoretical basis of the aspirational journey of any physician among us that we carry with the passage of time. Now, if we look at the responsibilities, naturally there is increase in responsibilities as we increase, and if we classify or categorize these levels, we can say that at the lower level we have certain specialty related responsibilities or needs when we are trying to be recognized as a good surgeon or a good cardiologist or physician or radiologist, whatever you call, related to our clinic, and we want to be recognized within our specialty. Then in this recognition and self recognition journey, self identification journey, there are certain departmental level responsibilities, expansion in our responsibilities from our specialty to the department where we belong to, and we are aspiring to become head of that department. Then the stage comes where we have certain institutional level responsibilities, and we look, our vision goes beyond our department, and we want to share our expertise and experience at the institutional level. So we are looking to be the principal or the head of that tertiary level hospital that we are working in, or we want to be at, as I said earlier, on some national committee or head of the professional association or some global association, or becoming a vice chancellor of a university or pro vice chancellor, etc. And then we want to naturally be recognized at the national or global levels. I want to be in the national committee on XYZ, on the development of the system, or whatever you call it. So there is expansion in our responsibilities as we gain more expertise and experience in our day-to-day work. You could categorize it into these levels. Now, when it comes to the responsibilities, naturally there is expansion in the role and responsibilities of the person. There is a change in our responsibilities, if I may say. Now, can anyone say that how would the responsibilities of someone at the departmental level will be different than the responsibilities at the national or institutional levels? Can we name a couple of responsibilities maybe in the chat box? Responsibilities at the specialty or department level, they are different than the responsibilities at the national level. How could they be different? Any example from the group? Jabeen, can you read in the chat box, please?
Yes,
Where
sir.
I can.
Right now, there's nothing, but if please write it down. What do you think you have among any of these responsibilities that you are currently serving as?
Currently
National.
serving at the national level, if I may ask, any one of you having responsibilities at the national level, maybe within your specialty or uh, some related to your maybe association at the national level, or how do you aspire to contribute to them, to your field at the national level?
Sir, some are saying it's always vision driven, national focal person, if of dental curriculum, national leadership.
Absolutely. So, leadership related responsibilities, you want to lead your institution or your profession related to national focal person. For dental curriculum, it means that you carry the responsibility to contribute to the dental curriculum, and if it is in Pakistan, then we are talking about 70 dental colleges. It means what the responsibility you are aspiring to contribute to, that will impact thousands of dentists that are being produced at given time in that particular country. Good examples. Now the issue is that with the change in the level of responsibilities, you also are looking for a change in the skill set level. Is that so? Can we produce and develop a national dental curriculum with the same set of dentistry, the orthodontics, the prosthodontics that we were taught, the clinical dentistry that we were taught in the dental college? Or you think that the responsibilities of the development of dental curriculum or medical curriculum at the national level, and then implementation of that curriculum, the involvement of the stakeholders, monitoring and evaluation of the curriculum, the competencies that you decide, the assessment system, the variation in the quality of dental colleges across a country in different geographical regions. Do you think that our clinical dental skills are enough to take us to that national level, that we can contribute with the same skill set that we have been running our department? We can contribute at the national level with the same skill set? Any idea? Or you think a different skill set is required?
There are some no's, definitely not. Responsibilities are huge, and skill set that we need are beyond basic education. Different skill set is required.
So if a different skill set is required, where shall we get that skill set from? Is there any structured education system available at the national level that we can follow to acquire that skill set that is there to be required at the higher level? I have been reading and observing since almost childhood that XYZ bureaucracy, and this is what we had been reading even in the newspapers, and I'm sure that you will second me, that XYZ person is going on leave for the next 2 weeks because he will be attending a course to be promoted from grade 20 to 21. I'm talking of Pakistani background. So the deputy commissioner in Punjab, 10 deputy commissioners will be on leave from this date to this date, because they will be going to their health service, their services academy, not health services academy, but their superior, whatever they call the services academy, from this date to this date, because if they do not attend the course, they will not be able to get promotion from their grade 20, for example, to 21, or 21 to 22, whatever their grades are. And the same system is followed very strictly in some professions that you are very well familiar with, in case that they want to contribute to the higher levels. Do we have such system in different countries? In the countries that you are attending, Iraq is there, Pakistan is there, India is there, Saudi Arabia are there. Do we have such system for medical doctors, for health professionals, for nurses, for dentists, for pharmacists, that they want to contribute to the system. They want to rise up from their clinical expertise at the department level. They want to rise up to the institutional level. They want to be head of the department. So they must attend XYZ course, or they want to be the part of national committee, or they want to be the part of, for example, national curriculum committee, or they want to be in the medical and dental council. So they must have this, acquired this. We make sure that they acquire this skill set. Do we have such kind of system for medical fraternity? Probably not. And this was a gap that at the WHO level, we had been trying to address this gap and develop some kind of governance system to equip our medical fraternity with the kind of skill set that is required at the higher level. Now, this is exactly, if I give you the example, that when we rise from the departmental level, if we have been driving motorbike, then we are trying to drive a heavy duty truck at the higher level with the same license of the motorbike, and we expect that we would be able to drive the truck. That's how I can relate to. No, we need different licenses to operate in different kinds of environments. So specialty related skills and other skill sets, probably our specialty related skill set will not take us, or clinical skills or technical skills, if you call them, it will not be enough to take us to the higher levels as we aspire to be. If I ask you, think of the past 10 years, what your roles and responsibilities had been, and think of the next 10 years, the kind of roles and responsibilities that you will be playing, the kind of skill set that you should be looking for, and finding out the ways on how you are going to develop your competencies or skills to meet with the seniority levels and needs that you are expected to perform in future, for that matter. And this is the skill set that we are talking about. We need to pay attention to our leadership skills, governance skills, communication skills, emotional intelligence skills, systems thinking skills, and so on and so forth. There is a huge list of these skills and competencies that we need to pay attention to, have deliberate attempts to improve our skills to excel within our system. Now, this is what I have already said. I will move forward. That's where we need to have some kind of background knowledge of the system where we are working. For example, the healthcare system in Pakistan, in Saudi Arabia, or Iraq, or India, or USA, or UK. There are different systems. These systems are different. Their processes are different. Their structures are different. Their rules and regulations are different. If we do not have the background knowledge of the system that we are operating in, we probably will not be able to contribute to the development of national, for example, dental curriculum, if we do not have adequate knowledge of the system where we are working. So this is, I am talking of uh, uh, health system, our healthcare system or health system. Now, what the experts say, that health system is a complex adaptive system. That's the type of system they classify. There are different classifications of the system. There are design-based systems, linear systems, complex adaptive systems. What does it mean? We need to understand the intricacies, the dynamics of our healthcare system. particularly our healthcare system and healthcare system in general, because it is classified as a complex adaptive system. It is non-linear. It is multiscalar. It has diversity. The outcomes are usually difficult to predict. It contains multi-stakeholders. Stakeholders have different interests. It has complex outcomes. I don't have much time, to explain, getting into the intricacies of all these terms, but that's how we classify healthcare system, that this is a complex adaptive system. And even this system is then working within a larger ecosystem of the political system that we are driving in, the socio-cultural system, the medical college, the attached hospital to it, and the healthcare system that we are working in. This is very favorite slide of Professor Hamdi, where he explains the system. And then he says that even our healthcare system is working within the larger ecosystem of the socio-political system, where there are competing interests between different subsystems, you can call them, and health is one of the subsystems then. So I will not get into the definitions of what a system means and what a complex adaptive system means. You can read these definitions, and in today's world, we can just Google and find out what does a complex adaptive system mean and what are the qualities and attributes of a complex adaptive system, and why health and education both. Health is a complex adaptive system and education is a complex adaptive system. But then we are talking of health professions education. Now, this is where we are at the cross section of the two systems, where we are dealing with health as a complex adaptive system and education as well as a second complex adaptive system. And when the two systems multiply, you can imagine the type of complexities that we need to account for if we need to have tangible outcomes to be driven from the system. These are some of the reasons why we have difficulties in even dealing with our health professions education systems, and we have so many wicked problems in the system that we are unable to find out uh, the straightforward answers, because there are no straightforward answers to the kind of issues that we deal with within our complex adaptive systems of health professions education as well. And I will give you a few examples later on. So this is the kind of, we have so many wicked problems, so many complex problems, so many persistent problems, so many problems that are difficult to stop, difficult to solve even, because when we try to define them, we can't even define. We want a curriculum, for example, I give you one example. We want a curriculum that is away from traditional curriculum. We don't like subject-based curriculum. We don't like teacher-centered curriculum. We don't like hospital-based curriculum. We want a curriculum that is community-based, that addresses the needs of the community. We want a curriculum that is competency-based, because we have over 100 medical colleges. So we don't want to diversify in our competencies. We want a curriculum that addresses interprofessional education, because at the end of the day, we work in the form of teams. Okay, fine. So how do we define a community-based curriculum? No agreement. How we define a competency-based curriculum? We even don't know what's the definition of a competency. And when we are struggling with the definition of competency, someone says, no, this is actually competence. This is not competency. And then someone comes and he says, what about interestable professional activities? Then comes someone, but we need to have interprofessional education and collaborative care. How do you define it? so difficult to define. Solutions, worldviews are different for these. These are unique, they have own unique context. So these are very wicked problems that we are dealing with, and our clinical expertise that we gained in the medical college, dental college, that may not be able to take us forward. We need a different skill set. Some of the wicked problems. I mean, this is just a few. I can list maybe tens more. For example, what transformations are needed in health professions education curricula? That is one example I elaborated on. We need to transform, and that's the kind of, we even don't agree on definition, then not to talk about other intricacies of curricular transformation. How can different professions work together, which is teamwork, to provide services more efficiently, effectively? How does a dentist collaborate with a medical expert and a nurse and a pharmacologist and allied health professional? How do they form team? What do we call this team? Government wants to follow family practice-based model of care. Family practice-based model of care depends on family practice, family team, family practice team. How do we define the team? What competencies are needed, etc. How can the quality of education be improved? What quality is needed? What standards? What accreditation system? How to take it forward? Do we have even a robust accreditation system? How can service coverage be increased from 55 to 65%? I don't want to get into the intricacies of what do we mean by service coverage. How can a CPD system be developed? Do we have a CPD system? Do we know what is the definition of our CPD for that matter? So each one of them is a wicked problem. Each one of these problems, there are no defined outcomes. There are multiple stakeholders. We are talking about systems, each one of them. We are talking about systems, and we even don't have the basic knowledge of the systems, that these are complex adaptive systems. And there are no straightforward solutions. So what kind of expectations we have? What kind of monitoring and evaluation systems we need? What kind of standards of care we need that we can take them forward? These are the kind of wicked problems that as we get at the senior level, we get across. And definitely we need a different skill set to deal with these problems. The big gap. Now, the big gap is that clinical competencies are not enough to take us forward. But our thinking, it does not allow us, and unconsciously, we try to solve these wicked system-based problems with the same clinical competencies or the haphazard kind of knowledge, unstructured knowledge that we got through our experiential learning. We try to solve these problems because we don't have an inbuilt structured system to develop ourselves in a structured manner to take us forward to the senior levels to deal with these issues and problems. There is severe lack of capacity building programs, and that is one program on governance and leadership of health professionals education that I will be talking about later on, that we have been working on. So what set of skills I showed you one, but if we differentiate and we categorize, and we need some kind of leadership skills, some kind of governance skills, we need interpersonal skills, and since we are academicians, we need some academic skills as well. There is the list of skills. These are just a few of them. These are not exclusive. It does not mean that we don't need leadership skills in the governance category. They overlap. So don't get into the kind of intricacies how to put communication. For example, communication is an essential leadership skill as well. So these my emotional intelligence, that is the predictor of leadership skills. I have put it under interpersonal skills. You can safely put it, you can safely put all interpersonal skills under leadership skills as well, because eventually a leader should have interpersonal skills. So there is no first hard and fast rule and even definition and the solid categorization of the skill set that is needed. We need to identify the skill set and we need to work on this skill set on our own, having our what we call personal development plans, PDPs, and our own capacity building and our own continuing professional development and our own faculty development. These are some of the names that we give to same kind of system that we know. So some of the governance skills that we need is we need solid knowledge about the governance structure and system and processes that pertain to our country, because different countries have different governance systems and processes. So we need to understand them. What are the bylaws, what policy, what procedures, what planning mechanisms, what rules and authorities, because eventually every system works within that rule and authority um, that is identified and given vested upon to us by the Supreme Parliament, for that example. What human resources and what other resources and what financial resources, what strategic resources are needed. If certain policies are needed, then how do we develop the policies? How do we do risk assessment in the analysis and development of policies? That is a topic in itself. Do we know how to do risk management? What about quality improvement? What about quality management or continuous quality improvement or enhancement of the system? How to incorporate it within the system? Now, these are some of the governance skills that I have listed here. You can even add more skills that you can do your own self-assessment and you can do your own reflection on what skills uh, you need to perform the basic governance functions at the higher level that any senior level physician or health professional should know before he ventures into the planning process, etc. And then I try to differentiate between good governance and bad governance, that we need to have clear governance structures compared to vague governance structures, where they are not, if an organization is in problem, if we have vague governance structures, clear line of authority and accountability, decision and performance, well regulated and audited. If a decision goes wrong, then we need to be asked, we need to be held accountable. Why did the decision go wrong? Analysis needs to be done. Check and balance has to be there compared to no accountability or no responsibility of decisions. Open communication, clear financial budgeting decision making processes compared to secretive processes. Boss is right, boss is always right. He knows. There is no transparency, there is no accountability. Autocratic kind of system, no access to information, no public scrutiny, etc. Forward looking, inclusive system, multiple stakeholders, as I said earlier, to compare to reactive and short sounds. Today we solve our problem. What is the issue and problem today? Ad hocism, as we don't have long-term sustainable policy planning vision, etc. So this is how you can compare that good governance then requires certain skill set that I have talked earlier. So if we talk of the wicked problems and the governance and the leadership that we need, then how to solve it? Solution, action. तो करें क्या फिर? We need to work on one more skill. So in that list, you can add one more skill that I'm going to introduce here. That is what we call system thinking approach to problem solving. I have a separate presentation on problem solving skills that I used to teach to my MHP students. I remember I used to have a presentation, 2 hours workshop on problem solving skills and problem solving strategies. So systems thinking approach and systems thinking is being promoted and used as problem solving strategy to deal with wicked problems. And we need to naturally read more about what system thinking uh, is. There is a lot of literature, wonderful uh, YouTube short and medium scale videos available on YouTube that you, in your free times, feel free to just to type in YouTube system thinking approach or strategies, and you will see different people explaining uh, how to improve your system thinking skills. Now, this is one of the resource that I would certainly recommend you to go through on systems thinking for health systems strengthening. If we need to strengthen our health system, that is a complex adaptive system, we need to have the baseline knowledge of what the system is. Then we need to strengthen it. How can we use system thinking approach? Now, replace health system with health professions education system that is equally adaptive system. So when you read systems thinking for strengthening health system, you can very easily apply the same concepts to strengthening your health systems, health professions education system strengthening through systems thinking approach. Now what we have done so far, let me show you this slide before ending and taking more questions. We realized this problem in WHO. So one day we decided that let's work on it. And what we have worked on is that we contacted about 10 systems experts from the region. I remember there was one from Kuwait, Professor Hamdi from Emirat, Dr. Ruweda from Jordan. There was Sheikh Badr from Sudan, Sabeen Siddiqui from Pakistan. There were 3, 4 others. And we invited them in Amro. We presented this challenge and we locked them in the rooms of the hotel for 3 days. And we said that you have to give us a short course on developing governance and leadership skills in health professions, education particularly. And all these 10 experts, they gave us these 5 modules to be taught in 4 days on uh, how to develop your governance competencies or skills. And the first module included introduction to governance and leadership of health professions education institutions. Second was emerging trends in the governance and leadership of health professions education institutions seen through systems thinking approach. Then the third module, we thought strategic planning is very important and there should be a separate module on it. And we called it strategic planning for health professions education institutions. And we thought communication runs across and it has to be dealt with as a module. So effective communication for governance and leadership for HP institutions. And we thought that quality also needs to be emphasized. And we had a short module on improving the quality of health professions education institutions. There are experts in the countries, in your countries where you belong to. You can sit together, you can consult globally, regionally. We are there to support. And I'm sure you can develop your own courses on how to strengthen governance systems in health professions, education, to deal with some of the wicked problems that I have told you earlier, and effectively actually strengthen the system of your own health professions education institution. And when I say health professions education institutions, I include all health professions like the medical schools, the dental schools, pharmacy, allied health sciences, and they run in there are over 1,000 institutions in Pakistan alone, and tens of thousands in other countries. How do we deal uh, with the governance issues? How do we make policies? How do we make strategies? How do we settle with their business planning? What is their financial planning? How do we assure quality? How do we make sure they run competency based curricula? How do we assure the standardization of competencies? How do we assure the accreditation systems, and so on and so forth? So this was what we have done initially in WHO. Then not only we developed the course, about a year ago, we ran our course in Kuwait. That was our pilot test. We invited about 40 participants from about 16 different countries in the AMRO region, and we ran that course. We got further feedback to refine the content of the course. Now our counterparts in Syria was telling that end of this month they will be running the same course in Syria, and inshallah in our ninth international conference on health professions education, we'll be running the same course in Lahore, Pakistan as well. This is the plan for this year. Next year we'll be running more courses. This is our beautiful colleagues from the course that we ran in Kuwait. You can read the banner on the side. It says capacity building program on governance and leadership of health professions education institutions. We ran it from 7 to 10 December 2024. I think I will stop it here. I leave about 15-20 minutes for any reflections, comments, questions, etc. Thank you so much.
Thank you so much, Sir Gowhar. Now I will open the forum for further questions. Any comments from anyone? You can unmute yourself or raise your hand and or put in the chat.
Can I
But sir,
just,
there are yes,
uh,
sir. Please go
Dr.
ahead.
Shalini, as expected of Professor Gowhar Wajid, this was an extraordinary session. It goes without saying that he does not deserve any further compliments. I would just like to add one thing, that the GMC UK runs these courses regularly. For example, we have to do these courses on an average 26 courses in a year for maintaining a license to practice. One of them is governance. And I think this is exactly what's needed in our countries. I'm talking about the Asian countries and the Middle Eastern countries, that we have no concept. I mean, allow me to, I'm not being disrespectful, generally speaking. Governance is a major issue, and policy making is a second thing that you mentioned. And most importantly, that you mentioned your thing, that what kind of curriculum do we need for all these different nations? There is no consensus. So there ought to be a body, a national body, a regional body, maybe international body, and you're the best person to advise us. There are lots of scholars. I can see President of the College of Physicians, Surgeons, Pakistan also in this, and many other scholars. So perhaps we can have a debate on that. Over to you. Thank you so much. And thank you, Jabeen, for running it so well.
Thank you so much, sir. But sir, there's a lot of comments in there about the course, about quality assurance, etc. Yes, Dr. Abdul Razak, please go ahead.
My question is that do you think it really works in the real world about governance? Because for governance, you need a lot of vices, not the virtues like loss, like integrity. But you need a lot of political support and a lot of things. What is your opinion? Do you need a lot these skills and working on these? I think I don't know.
Uh, See, this is another wicked problem. We need to have a different lens to see, to have our vision and look at the problem. Eventually, health systems experts, eventually the clinicians, has to deal with the politics of health professions education. There is a lot of politics around. So if we are not into networking, if we are not into having enough skills related to emotional intelligence, for example, and we need to drive
That lady.
everything with the clinical lens only, that I have been running the department in a very effective, efficient manner. So now I want to be at the national committee. Probably we will fail. So first we need to realize that a different set of skills is required. We need to realize that probably the problems are wicked. We need to have the baseline knowledge of the political system, that the slide of Professor Hamdi, the overall ecosystem in which the health system works. If we are deficient on these lines, we may not succeed. We will never succeed 100% because these are wicked problems. But even if we start succeeding to an extent, then that opens a way for and provides us encouragement to work further on these lines.
Thank you so much, Dr. Gowhar. There's another hand up. Zoom user, please go ahead.
Assalamu alaikum. I am Professor Shamsa Humayun. It was it's always pleasure to listen to Dr. Gowhar Wajid. So my question is that I really enjoyed the slide wicked problems. So in our setup, as you visit Pakistan many times, and just one of the participants asked question about the curriculum, standardization, quality assurance. Sir, my question is that modular system is in place now by UHS, but you know and I know and many of us educationists, we know that still we are struggling. So there is a problem of governance, or it is the implementation, or after so many years still our faculty is not used to still our faculty is not at the par to implement this modular system.
Absolutely, Professor Shamsa.
Sorry, sir, to interrupt you. Can you stop sharing the screen? There's a request in the chat.
Yeah.
Sir.
Stop sharing the screen. Okay, sorry. Share. So absolutely, Professor Shamsa, I totally agree with you. See, I tell you where the difference lies. I had a patient where his knee replacement was supposed to be done. And actually, both sides were replaced by an eminent surgeon in Lahore. And the expectation of the patient was that he will be able to perform the same kind of activities after knee replacement as well. He will be as young as 20 years old guy. That was not possible. And you know that's not possible. A 60 years old cannot be a 20 years old, you know. So these are wicked problems. There is no straightforward solution. That's what the wicked problem is. It does not have a straightforward solution. So if there is no straightforward solution where even a competency is, there is a debate on how to define competency, the kind of success of the modular system, even if we succeed 30 to 40% in implementation in the first go, and we have a robust monitoring and evaluation system, we have a robust governance system backed by robust governance system, and we can, Yanis, in AMI held just last week, and one of the my students was there, and he was telling me that the college in Vietnam, they said it took us 17 years to completely implement competency-based curriculum. In one college with full resources, it took them 17 years. So how on earth can we expect that in 80 medical colleges in Punjab alone, we can implement 100% success the modular curriculum? There are bound to be failures, and we should be ready for the failures and how to deal with the failures. That's what the context of a wicked problem is. So as long as they have the monitoring system, they have evaluation system, and they are ready to deal with this wicked problem, eventually they will be successful.
Okay.
Thank you,
Thank you,
sir.
sir.
I saw another hand up, but then it goes down. Is it Dr. Mash? Do not want to take the wrong name. Any other questions or comments?
Yes, I am Dr. Marshu. But
Yes.
sir has already defined my question, so I become I down my hand.
Okay, thank you, Dr. Mashukali. It seems like there's no more questions, so I would tell some three of my take homes from this session, and I would encourage you all to put your take homes in the chat as well. The three take homes that I am getting, sir, from your today's presentation, that we should start thinking beyond the clinician role, that how we can embrace leadership and governance responsibility at departmental, institutional, national, and global level, and not just focus on our clinical care. The second take home for me is complex adaptive system. And I will talk to you, sir, offline, because I have published an article how simulation and complex adaptive system, when we are doing a global collaboration, works. And one paper is in progress, that both healthcare and health profession education are interconnected system. And if we want to develop sustainable solution, it requires system thinking approach rather than just do a quick isolated fixes. Sorry, I get yes, Abdul Razak, I know form is not accessible. Just request the access and you will get the access and you will get an email. My third take home is leadership competencies are essential for each one of us. And if we want to be prepared for future roles, we do not need only to focus on how to be a physician, but also structured capacity building in governance, communication, emotional intelligence, policy making skill, which usually get missed in our traditional clinical training. So I would like to challenge you all that as we close, I invite and challenge each one of you to reflect on how your role is evolving beyond a clinical expertise. Effective governance and leadership in health profession education require to think in systems, build not technical skills, and prepare intentionally for future responsibilities. So, sir, these are some of my points which I'm taking from today's session. Any final remark by you, sir?
Thank you so much, everyone, for your valuable time, precious time. And it's always a pleasure to share my views and ideas with you. And some of you from Pakistan, maybe you will be there to attend the course in Lahore as well. That is an elaborative version of this course. And thank you so much for Professor Zadi to provide me the opportunity to share my views.
Yes, thank you so much, Professor Zadi, for providing us all this platform to satisfy our kind of intent to disseminate education and to get it to the people, like I would say, to reach to the unreached. So thank you so much for providing us this platform.
We're grateful to you, for moderation, and Professor Wajid for enlightening us. CV is yours. You're welcome anytime, and you have to come back, Gar. You have to come back
Inshallah, inshallah.
in
Yes.
due
Thank you
course.
so much, sir.
Thank
Bye.
Thank
you.
you,
Thank you so much.
everyone.
Thank
Have
you.
a wonderful weekend. Stay safe. Take care of
Allah
yourself
Hafiz.
as well. And we will see each other with another exciting session. Till then, Assalamu alaikum. Allah Hafiz. Take care. Bye bye.
Wa alaikum
You.
assalam. Khuda Hafiz. Khuda
Thank you.
Hafiz.
Nafis.